Welcome to Raaonline Anatomy lecture series. Today, I am unveiling this lecture with a pink ribbon. Pink ribbon signifies breast cancer awareness. A disease gains its importance in medical education based on its impact on the society. Breast carcinoma is the most common cancer in the women worldwide. 1 in 8 women is affected with breast carcinoma in her lifetime. Every year, October month is observed as Breast Cancer Awareness Month. A complete month for the awareness of the disease in itself says the importance of early diagnosis of this disease in preventing the death due to cancer. A patient may come with the complaints of a simple breast mass or skin changes in the breast or any other symptom which is unrelated to the breast. So, the medical graduate should be able to diagnose the cases with the complaints, and for this, the medical graduate should be competent with the anatomy of breast in Phase 1 MBBS. This is the competency given in Phase 1 as per CBME curriculum. Based on this competency, these are the objectives for this lecture. What is breast or mamma? Is a hemispherical elevation over the pectoral region. This is a soft tissue elevation in the superficial fascia which is covered with skin. So, breast is a soft tissue mass covered with skin. The gland present in this region, like the sweat glands of any other region, is modified to secrete a special fluid called that is milk. So, the gland in this region in the mamma is called as mammary gland. Mammary gland is a modified sweat gland in the region of mamma or breast which secretes milk. So, breast is a soft tissue elevation with a skin covering. Mammary gland is a gland which is a modified sweat gland in the mamma. But in common practice, breast and mammary gland are used synonymously. So, we will see the location, extent and deep relations of the breast along with the applied aspects. Throughout this lecture, I have given the applied aspect in separate boxes for easy understanding and following. As we have seen earlier, breast is present on either side over the pectoral region in the superficial plane. Breast is present in both male and female, but it is well developed in females after puberty. Both in males and in the prepubertal females, it is in the rudimentary state. The extent of the breast may vary in individuals, but the base of the breast has a constant location. The base, which is circular in shape, extends vertically from the 2nd to the 6th rib along the mid-clavicular line and horizontally from the lateral border of the sternum to the mid-axillary line along the 4th rib. The level of the nipple also varies, but it is constantly present along the 4th rib. Though breast is present in the superficial fascia, there is a small extension of this breast which pierces the deep fascia of the axilla and enters the deeper plane. This part of the breast, which is called as the axillary tail of Spence, is a projection from the upper and the outer quadrant of the gland. It pierces the deep fascia of the axilla, and this opening in the deep fascia of the axilla through which the axillary tail of Spence enters the deeper plane is called as foramen of Lange. The clinical importance of this axillary tail of Spence, it is in close contact with the axillary group of lymph nodes, and when it is enlarged, it can be mistaken for lipoma because we know that the breast is present in the superficial plane. We do not expect that in the deeper plane, and when it is enlarged, we misdiagnose at lipoma. The deep relations of the breast. Breast is present in the superficial plane and it lies over some structures which are in a deeper plane. These structures are called as mammary bed structures. These structures are the muscles which are pectoralis major in the medial 2/3, serratus anterior in the lateral 1/3 and external oblique muscle in the infromedial quadrant. This is pectoralis major. Pectoralis major in the medial 2/3, serratus anterior in the lateral 1/3, and external oblique muscle in the infromedial quadrant. These muscles are covered by a deep fascia. So, pectoralis muscle is covered by pectoralis fascia, which is a deep fascia. So, pectoralis fascia is present between the breast and the structures which form the mammary bed.